Ramallah is a revitalized, growing city of 250,000. It is the commercial center of the West Bank and Palestine. New hotels and businesses are moving in, and investors from around the world are developing residential and commercial properties. But that development has passed many residents by. A financial divide splits the comfortable from the poor. Many face unemployment, chronic disease, and grinding poverty. And it's particularly hard on the elderly. This door is the entrance to a windowless basement, home to a family of 5. St. Andrew's Episcopal Church in Ramallah and its priest, Hannah Dolly, are addressing the needs of the poor through food deliveries, youth activities, and collaboration with other congregations.
We have a lot of poor people in Ramallah, but these poor people you won't see walking in the street that much. They're just sitting at their home, seeking for a job. It's not easy to find a job. So what we are as a church, we can do here. It's not just about opening the gospel and preach it. It's about showing the gospel from our hands. So we are finding them and offer for them the multiple help that they might need. First, we help them in food and we still, but we figure out that they need more help, not just food, they need health help. As a poor person here or poor family, they cannot be in support to go to hospitals, to clinic rooms, because it costs a lot of money. So we thought about building a project to reach to these people who are in need, because there's some of them, or a big number of them, old people, who has problem in their hearts, who have diabetes problem. It's not easy to get the medicine to them or to get good treatment to them. So we felt this is what God is calling us to do, to reach for these poor people, because we were refused to accept that the poor person will die because he has nobody to help him, and the rich person, he will go to the hospital and to get good treatment.
Travel in the West Bank is severely restricted, so those suffering from chronic illness have difficulty getting to a hospital, getting to the care to keep them healthy and productive. Outpatient clinics are an important component of the health system here. The Right Reverend Suhail Duwani, bishop in Jerusalem, understood the need for a subsidized outpatient clinic addressing the specific needs of West Bank residents. He added 2 floors above the parish hall at St. Andrew's, with one reserved for the clinic and one to be rented out to generate revenue. He believes this is the time to invest in Ramallah, to invest in our brothers and sisters struggling in this volatile region.
We need some investors to come and work with us, because as far as we are having plans and good plans for the future, so we are inviting investors to come from the whole Anglican Communion and Episcopal churches to come and work with us. For this is a very vital project for the future of the Diocese of Jerusalem in this land.
Bishop Duwani invites you to help support the St. Andrew's Clinic. It will deliver a combination of primary care and highly specialized care for diabetics. Help us address the impact of the high incidence of diabetes in the Holy Land. And at the other end of the spectrum, help families get treatment for simple childhood infections and illnesses. Minor conditions often go untreated because families lack the funds to see a doctor or afford medication. Deafness and blindness are the result. Locally available treatment for diabetes means fewer cardiovascular complications, circulatory ailments, amputations, blindness, stroke, or heart attack.
We don't have any medical institutions in the area of Ramallah. And the area of Ramallah is very important because, as I mentioned, we have a very large community there. We have a very big church. It's a centralized city in the West Bank, and a lot of patients can come from the north and from the south. The vision of the Bishop Suhail was that we want something to help the poor, we want something to help the patient. On one side, giving primary care, and on the other side, giving very advanced care. A lot of studies say that diabetes today, it's very, very economically problematic disease from different aspects. It's chronic disease, it's a long-term disease, a lot of vascular complications, heart attacks, a stroke, leg amputations, and it's very terrible disease. It's very problematic for the patient itself, for his family, for the society. In the Western countries, the percentage of diabetes is 2 to 3% of the population. In our society here, in the Palestinian society, Christians and Muslims, both, the incidence of diabetes is something like 10%. It's 5 times or 4 times more than other societies in the Western countries. It's huge numbers of patients that have diabetes and have complications of it. And the most important thing is a Doppler, vascular Doppler for the legs, to check the legs, to check the carotid arteries that's going to the brain, and do screening tests for the patients, for the diabetic patient, before we already have the complications. The vascular supply for the fingers will be reduced, the vascular supply for the legs will be reduced, and this is how the patients become independent in the vascular supply, and later they need to have amputations. In behalf of these patients and in behalf of the staff that will work with these patients, I will be very grateful to thank anyone that can donate even $1 to buy this kind of machine.
St. Andrew's Clinic needs your help. The beautifully finished building is ready, but stands empty. Vital equipment still needs to be bought. With further investment, this waiting room could be filled with young families seeing primary care doctors. Older patients could properly maintain their diabetes and move on with their lives. These stewards of our Holy Land, these descendants of the apostles, need your help. Again and again, when we visit them, we hear, "Don't forget us. Please, don't forget us."